Good evening and welcome everyone to this evening's webinar. My name is James Carr, I'm the National Sales Manager at BTL UK. I will be introducing this evening's webinar and speakers. We have an exciting webinar lined up for you this evening, full of valuable insights in social media masterclass. Our first speaker I would like to introduce is Dr. Shiraz Khan, a highly respected award-winning dentist with special interests in restorative dentistry working out of central London. Shiraz has always been a huge advocate of education. He is currently the director of the Young Dental Academy, as well as a global ambassador for DMG, as well as other manufacturers. I've had the pleasure of working alongside Shiraz for several years now, and it is Shiraz's passion to help fellow clinicians through shared learning that makes him an exceptional clinician and speaker for this evening's webinar. Our second speaker is Michelle McLean. She is a leading aesthetic clinician and one of BTL's most innovative KOLs. Michelle has pioneered and developed life-changing protocols using our M-Face device, focused on helping patients with facial asymmetry and palsy. Michelle brings a wealth of knowledge to the webinar with over 19 years experience, a multi-award winning practitioner herself, having won Best Non-Surgical Result of the Year last year. Michelle owns a successful clinic in Liverpool with many of the skills and insights that we will be discussing this evening on Showcase every day to not only showcase the best results for her research, but also to drive business growth as well. Together, Shiraz and Michelle will be guiding us through the practices of photography and social media, offering fantastic clinical insights as well as practical advice. We are thrilled to have them both with us this evening. So I'll hand over to Michelle and Shiraz, and please enjoy this evening's webinar.
Thanks, James.
Thank you, James. Right, so thank you for that kind introduction. I hope you are all well. It's quite late here in the UK, and yeah, we've had a fantastic day at the clinic, but we're here now to share our points of view, our areas of expertise with regards to photography, social media, and frankly, how they are just a combined asset, really. And the way that we've designed this sort of webinar is going to be a series of essentially 7-minute TED Talks. So I'm going to have a topic, and Michelle's going to have a topic, and we're going to continue on in that process. Do you want to add anything, Michelle?
No, that's great. Thank you, Shiraz.
Good. Right, so the first talk, which is going to be the clinical imaging standard, and why the quality of your photos are going to demonstrate or be a reflection of your clinical care. Right, let's get that. So, I mean, why master great photography? I mean, at the end of the day, you know, for me in clinical practice, photography is absolutely a crucial part of my patient care delivery. It's not only a way to demonstrate your work, it's a way to demonstrate to the patient what's going on. It's a demonstration of your commitment to excellence. It's also essentially your signature fingerprint within your profession. And you know, in the world of aesthetics and aesthetic medicine and dentistry, it looks good, or the change is going to look good. So if it's something that looks good, having a visual representation of that is frankly quite critical to your business or business plan. So, you know, the other point is with regards to any photos, that's an opportunity for a patient to almost immediately be able to trust or attach themselves to what they see. You know, they may look at a patient and be like, oh my God, that's like me, and so on. So I think it's just about trying to understand that photography has the ability to connect patients, to understand what the problem is, and that there are other people like them, frankly, as well. And, you know, I'm here with, I'm sure, a mixture of medical and dental colleagues, but for those that know, this is a tooth with a metal filling in it, and the patient had gone to see an emergency dentist. They had done essentially a cavity from the outside, and the tooth was resorbing, so the internal stem cells were essentially eating away at the tooth inside. And this patient was traveling away to India for about 3 months, and she was told she needed a tooth out before she flew. Through social media and various other things, various other platforms, she'd found me. We'd gone through the stages of removing all the restorations, removing any area that was necrosed, root treating the tooth, and this is a picture of a root canal treatment, and you were able to rebuild that tooth to look like a tooth. Now, I appreciate all of those other slides are a bit technical, and I'm going to go into later on when you need to show something that's technical and when not. But I think what you'll understand is whether you're a dental professional or not, whether you're a medical professional or not, the situation from the left to the right is a huge change. And this is someone who frankly thought they were going to lose their tooth. So the fact that you're able to show these changes is so important to patients. And what's the relevance of all this? Why am I saying this? Well, like I've touched on, you're able to motivate your patients because they can see what you can see. As you can see, there is early decay in these teeth, for example, but there are other things going on. If you get a little bit closer, you can start seeing that there are these wear facets that are developing in the teeth. And that doesn't come from anything other than the teeth sliding over each other. So when a patient comes in, they're like, oh, I can see the black marks. Actually, with high quality imaging, you can start showcasing other aspects to their diagnosis and why they might need other treatment. And again, another example of a patient with, I'd asked them, oh, do you wear your teeth? They're like, no, not at all. It's quite clear that we can see incisal edge attrition or rubbing of the teeth surfaces together, which is causing this wear. If you don't have the appropriate technology or adjuncts to your photography, they may not be able to see this in a mirror if you hold it up in front of them. But it's also an opportunity to case document. So from the beginning, what's going on, what we did, how we got you to being disease-free, and what the restorations look like at the end. But and we're in a day and age of digital, and I'm sure Michelle's going to talk about this as well. But there are fantastic tools that allow us to start gauging and planning where we need to be. And it's always about, and Michelle will talk about, she's got some absolutely, frankly, cracking cases that demonstrate the power of M-phase. But you can see where you're going to get to at the end from the start. And that's always how I treatment plan. I need the end in mind, and then I break the steps backwards to how we get there. And you can only do that if you take good quality images. In dentistry, we have a lot of communication with the laboratory, and we had this scenario where we fitted this implant crown. The margins and the gum of the implant looks great, but at the end of the day, the shade was off. So if we're able to communicate with photographs, we're able to take our treatment protocols from say 10%, 50%, to 95%. We can really start getting to those small details that are going to maximize the outcome. But also you can start demonstrating your cases for other colleagues to learn. And I think the most important thing that I'm trying to get to here is that invariably, documenting your cases, sharing your work, sharing your workflow, gets you known within your colleagues, within your peers. That's how I met James through various other things that I was doing within dentistry. And, all of these little things will make a big difference long term. And, I don't often share this slide, but I thought this was a great one because on the left are my first ever attempts at a filling, which was in 2013. You can't even see which tooth I was treating, frankly. But now, when I'm taking photographs, I have refined my photography and clinical protocols to be able to restore teeth, not only so they mimic nature, but I can take photographs of them really, really well. And that allows you. So we all start somewhere. I think that's the summary from this point. We all start somewhere. We need to push together to try and get our standard to a better place, and hopefully, grow on this journey together. So, as I've said, we are in a day and age of medical legal documentation. We need to be able to diagnose. We need to be able to, if something goes wrong, we need to kind of document what's happened, but also communication with labs, publish your stuff, and also, for me personally, the biggest part of my career has been that it's driven up my own personal standards. So that was TED Talk number 1. I hope I kept you engaged. It's quite hard to do a 7-minute spat. But good luck, Michelle. I'll hand over to you for the next one.
Right, Shiraz, you have some amazing before and after photographs. Photography is absolutely spot on. So, before and after with confidence, how do we master lighting, angles, and consistency? So, We know the purpose of photography is for patient records and monitoring. We know it's for medical analysis. This tracks patient progress. And this allows you to document results from baseline through to current treatments, and it serves as a reliable progress tool for reference. It showcases your work. It highlights real good before and afters, which demonstrate your skill set to both existing and potential new patients. It supports and marketing conversions. Professional photography serves as market gold and can be a really powerful tool to promote your treatments, build trust, and ultimately drive bookings. It also helps during consultations with your patients to visualize potential outcomes, allowing them to feel really confident in the treatment that you're discussing. Showcasing real results helps your patient understand the procedure. It increases their confidence and your trust and their trust in you, the clinic, as a provider. Okay, so let's have a look at this patient. Before and after the confidence. So when we look at my patient Susie here, the patient position and the standard of this photography is something that I'm always striving to achieve daily in clinic. It's something that I reiterate to our staff during our daily team huddles and our monthly meetings. I want to ensure that all of the team are consistent with photography in order to showcase what we as a team can achieve. Okay, background and position is really important. You need to ensure that all your photographs are taken against a consistent background, whether that be a branded background or a plain wall, whatever works for you. Just make sure that we maintain uniformity between images. Position is also really important. Your patient needs to be positioned consistently in all photographs. If they're standing in the before picture, the after picture should be standing. When you're taking your images, always refer back to your first image to make sure that you can match the second image and replicate to get a really powerful before and after. If that means you need to use vocal instructions to guide your patients, then do so, or gently put them in the position that you need in order to capture those amazing befores and afters. Quality. Now this might sound really simple, but when you've took the photograph, always go back and check. It could be that you need to just clean the lens on your camera to ensure that your images are really, really clear. If they're not clear, clean the lens and retake. I find that purchasing some camera lens wipes in clinic in all the rooms really helps to keep the lens clear every time. And it's something that I would always do every time I've got a patient in and I want to take a new set of images. I want to make sure that the quality is sound, and little tips like this really make a big difference when you're looking to get great images to promote your services. Now, eye position. You need to ensure that, because it might sound easy again, but just ensure that your patient's eyes are open and looking in the direction that you want them to. Use vocal commands like we said earlier, or even put a focus spot on the wall. Direct your patient where you need to be. An expression. Make sure your pictures are like for like. If we need to smile to showcase it before and after, like I'll showcase later on with M-face and some of my facial asymmetry and facial pause of patients, they have to be like for like. No smirking, just natural and matching your very first picture. So you can create really good befores and afters. Editing and scaling. When taking images, really try and keep the scale really similar. The final presentation will show the same size on both before and after images. And editing. From time to time, you will need to edit your images, whether that be because of lighting conditions, which is out of your control. Keep this in mind. Your results must remain true to life and really avoid over-editing and enhancing images in a way that creates unrealistic or misleading outcomes. Key points that I would say to consider for consistent photography. Photograph all your patients using the 5 key positions, like I showcased earlier with my patient Susie. Ensure that your photographs are all taken on a branded background or a plain background. And move your patients around to make sure that you're always in front of the banner and they're nice and clear. If you've got a BTL floor mat, utilize this. This really helps to guide your patient photography to ensure those consistent angles. Check past images to make sure you're getting like-for-like pictures. Consider your facial expressions, like we said before. Eyes in the same direction. Clear the lens. Sounds really simple, but this will avoid really blurry images and use additional light sources if you need to. There's also some really good apps that you can look at, which is one in particular, it's called Studio, and you can change the background to black or white so that your image stands out and there are no distractions, and this maintains uniformity between images. This is also a perfect app to use if you don't have a branded background, or you've actually took an amazing before and after photograph, but you realise that the background of the image is really messy. Okay, we've just explained, these are the things that I would recommend for your key take-home points, really to reiterate consistent photography. And if you're having team meetings and you're running a big clinic, utilise this in your team meetings, your daily huddles. Make sure that you're really, talking to your staff on a regular basis, making sure that they're creating also good images, not just yourself, because this will really sell their services and your clinic as a whole. Over to you, Shiraz.
Hello. I mean, spectacular cases, Michelle. Thank you for sharing. So, what I'm going to talk about is starting to understand the strategic content creation for medical professionals. I think, within this, frankly, minefield that is social media, I think it's quite easy to just, post cases or post things and find yourself getting into tricky circumstances. I think what we have to understand is why we're doing it. So I'll move on to the next point. The first thing that I think is really important, and I definitely agree with everything Michelle's saying, because if your before and after clearly looks like it's in a different place, or in a different surgery, or in a different location altogether, or it's not the same angle, if there's no standardization, it's very, very hard for the mind and the brain to really be able to depict what's actually happened. I mean, so many times, I don't know if you've had this, Michelle, but you've almost looked at a before and after, and it's like you're playing spot the difference. you're trying really hard to look, and you're like,
Yeah.
oh, it's that tooth over there, or it's that eyebrow over there, or do you know what I mean? It's not immediately obvious, but when you standardize your image portfolio and profile, then actually it's very clear to be like, wow, what a difference. And that's the thing that patients, people, clients, companies, businesses, that's what they all go to. But what's really, really important is, and you're hearing this for the second time this evening, sorry to say, but we have to start with this end in mind, because sometimes, and I think you'll agree with this, Michelle, we're even quite shocked at how good the outcome was at times, right? How many times have you? There's been very few instances, fortunately, in my career, where I've been like, oh, I wish I took a before photo, because the outcome was so good, right, at the end. And I think if you now get into the mindset of standardizing your images, and I'll show you what we do for dental in a minute, then sometimes you will be photographing. If you photograph something to show um, uh, a cheek lift, or a front tooth filling, or a whitening case, or whatever, and actually you come a cropper that's something else improved as well, if you didn't image that to start with, you can't show the before and after, because you haven't got the standardization. So if you photograph something for its just specific purpose, you might lose some of the other opportunities that come with it. And I'm sure Michelle would agree with this as well. Often a single case can show multiple outcomes. You've done a multitude of, either if it's disciplines, treatments, and the overall picture is astounding. My example for that is, well, you could do a painting with black, greys, and whites, and then you could start adding reds, and then you could start adding blues, and then you could start adding yellows, and all of a sudden you've got this spectacular mosaic of different colors. If you just kept it in your mind that you wanted a black and white photo, you might have missed this fantastic picture that you got at the end. So for me, standardization is really, really relevant, and remaining disciplined to that is quite critical. So in dentistry, in my clinic, this is the absolute standard set of photographs that we're going to take for every new patient. And
for all my medical colleagues that are around the world. I'm sure you're like, wow, that's a lot of teeth. Yes, indeed it is. It's a lot of teeth. But every photo has been planned and has a relevant amount of information and has a diagnostic tool associated with it. And I think what I'm trying to say to you is, irrespective of whatever your discipline is, whether you do facial, whether you do dental, what you need to come up with is this standardized set of images that you will take for all patients as your starting point. That's a really big tip from me, that if you can have that as part of your, essentially your workflow, your new patient consultation or your consultation workflow, all of these photos that you see on the screen, they will take me about 4 to 5 minutes to acquire. Yes, there's probably some, as Michelle talked about, post-image modification. I'm not the sort of one who knows how to really use Photoshop or any of that, so I don't do much of that, but I do straighten, crop, and so on, because I think that's quite important in how it appears to the patient. And you know, I know we're talking about photography here, but it goes without being said. You know, we're in a litigious world, let alone nation here in Britain. We're in a litigious world, and we always need to be aware that we're carrying patient information. And I think we have to extend that for aesthetic medicine and aesthetics in general, because all of that information is patient identifiable. So we have to ensure that we've got the appropriate level of consent before we're taking photos, before we're sharing photos. So I work at the London Centre of Implant and Aesthetic Dentistry, which is on Wimpole Street, number 28. If any of you are around, by all means, come and drop by. Let us know you're coming. Come say hello. Come look at the clinic. Come see us. Come meet us. We'll go for coffee. And protein pancakes, because it's a really good spot that I took James to. Anyway, with our patients that come to the clinic, it's absolutely critical that they are signing this data protection and consent form. And if you see the options, it says, I consent to all my images being taken and used anonymously. I consent all of my images being used anonymously, apart from those without identifiable face being shown. And I do not consent any of my images to being used outside of the purposes of clinical care for LTID. So if you read into that, every single option is I'm taking photos. It's just the level that we share them at, which is important for patients to understand. So please make sure you get consent before you start, you know, putting things on social, because the minefield that is social, once it goes up, it's not even your property anymore, frankly. So you need to be making sure that you've got the appropriate consent in place. But once you've standardized, you can then start honing into the elements that you want to showcase, the aspects of this case, or also actually even the audience that you're trying to reach. So what I'm trying to say by this slide is that if we're doing educational posts for other dentists or other medical aesthetics colleagues, you may turn around and start showing step-by-step procedures and perhaps surgical, if you do any surgical things, surgical procedures, that sort of stuff. But if it's a patient profile that you're raising, they do not want to see a needle going into a face, by and large. They don't want to see any gore. In fact, they don't even want to know it's happening when it's happening, right? So the reality is you need to be able to tailor the data and the imagery that you're showing to your target audience. So again, starting with the end in mind, if you're going to have a patient-facing profile, start with the end in mind, do everything patient-facing. If you're going to do it because you want to raise your profile within the profession and you want to be an educator, maybe you need to do it that way. So for example, this is a quadrant set of views that are the steps used to doing a very, very simple back tooth filling. So you start off, we use rubber dam isolation, we remove the decay, we restore the tooth, and then we check that the bite's okay. Do you think the patient is interested in almost any of those photos? Not in the slightest. In reality, they probably want to see before, maybe after, but generally speaking, when there's blue marks or even red marks on the teeth, they think they're bleeding everywhere. So, in fairness, they don't really want to see this level of information. However, if I was now sharing this in a dental conference, this is an important series of photos to show the steps and procedures that we do in place. So again, start with the end in mind, know your audience. Am I going to post this for patients, or am I doing it to attract other people to potential courses and things? Moving forwards, If there are patients that are coming in, this is the sort of thing they want to see. They don't even want to see the lips retracted like I showed you in that series of photos. They want to see a smile. They want to see a face. They want to see something that they can relate to. And I think what I'm trying to say by this small section is that if you're able to optimize and understand what, as a patient, you would want to see, then you can start framing your social media presence according to that. And that, it goes without being said, you can't do that without having high quality photography equipment or cameras and whatever to take those sorts of images. So yeah, that's the next part for me done. But hopefully it's just about trying to think about your audience and how you're going to engage.
Thank you, Shaz. Right, so what makes a good social post and why might not yours not be landing? Create content that really resonates with your audience, but stay compliant. High performing posts is both an art and a science. In this session, I'm going to break down the core components that make content not only engaging but visually effective, but they're also aligned with the Advertising Standards Authority regulations and brand standards. So the anatomy of a high-performing, compliant, engaging content. It should have clear intent and purpose. Every post should have a clear goal. What are you looking to do? Is it educate? Is it inspire? Is it inform? Or is it convert to a booking? Avoid posting for the sake of visibility alone. If you're doing something that is over a course of 4 sessions, wait until the last session so you've got a really powerful before and after. Make sure that your post is compliant and ethical messaging. Avoid over-exaggerating or misleading claims and be really mindful of the Advertising Standards Authority, the Regulations Committee for Advertising Practice, and your GMC, NMC guidelines or your area of posting. Human touch and trust signals. Really introduce your team, your ethos, what makes you stand out, why are you in this industry, what are your qualifications? Behind the scenes content can really foster approachability and give a real connection to those people that are looking at your page that are ultimately going to convert to a bum on seats in your practice. Okay. So, how can we use social media to gain interest and get patients in for consultation? We know we can use social media platforms to communicate with existing patients, but also to gain new potential patients. Immerse your followers in every aspect of your content. In marketing, we often hear the rule of 7. Now, this rule implies that a potential customer needs to see a brand's marketing message at least 7 times before they will make a purchase. This rule relies on a constant drip feed of impressions to build knowledge, trust, and repetition of your product. Really use this rule loosely. We can plan an effective marketing strategy that slowly and consistently engages your followers. Use a variety of content like you can see here to capture attention. Even post patient testimonials in text or video form. Showcase in action videos and really familiarise your patients with the treatment. Post statistics about the treatment or the modality, and most importantly, like we've been saying throughout, post really great befores and after images. Make sure you prioritise collating great images, consistent angles, good lighting, sharp images, no filtering, no editing. And try and brand your content so that viewers can find their way back to your channel if it's reposted. Okay, so what really makes a good social post? What are the key components? A great post is clear, it's engaging, it's relatable. The caption should speak to your audience's concerns. Really make the post feel genuine rather than overly sales-driven. Incorporate a mix of content, images, videos, behind-the-scenes clips, and reels to keep it really fresh. And show personality with yourself and your team in the videos. This builds trust through authenticity. And really add value and education. Use statistics, use infographics. Keep your followers informed, while client testimonials, obviously shared with permission, really reinforces trust and results. Okay, so meet Kaylee. This was a combination approach of Emface and Toxin. So why did this post perform really well and it reached over 2.2 million views? It's the content. The post combines really visual, engaging content with strong results-driven approach. The format is clear. Before and after images really grab your attention. The delivery. This was posted at optimal time from my audience using a captive caption and relevant hashtags that contributed to its success. By focusing on tangible results like this, the post encouraged high engagement, shares, and saves, making it a really powerful tool for attracting new patients, and the content was compliant. Remember what I said earlier? If you've got some amazing befores and afters coming through and someone's having a course of a treatment or a combination approach, try and really wait until the end so you've got a really incredible, powerful before and after to showcase. So what other high performing content do I have on my page? Let's take a look. Some of my facial palsy patients, as you can see here, displayed, showcase the real power of N-Face as a standalone treatment or a combination approach with toxin. And these have had, as you can see, an incredible reach. Featuring before and after images really helps build trust and relatability for other facial palsy or asymmetry patients coming into your practice, and incorporate the key elements that we discussed earlier in what actually makes a really good social media post. Make a constant effort to really share high quality, purposeful content. We know that social media can feel really overwhelming and all-consuming, with constant pressure to keep up, stay visible to both new and existing clients. This pressure can lead us to post content that doesn't really truly reflect our best work or our strongest results, and it doesn't have to be this way. Like I've previously said, don't fall victim to posting for the sake of it. If you feel the content is only a snippet of the expected results, just hold off. Hold off and post when you've got those really powerful befores and afters. These will create a massive impact on your page, so really save these. So some little tips, what tools can we use to help with social media? So utilising the right tools is essential to creating high quality social posts. Utilising apps like Links.com and Meta Business Suite really help and optimise times for posting your content to ensure you have maximum engagement, to make sure that your content is seen by the right audience at the right moment. Portable lighting. We know this, use ring lights. You can get some really great clip-on LED panels, and this ensures that your photography looks really professional. Tripods, if you've got a tripod, provide stability for smoother content capture. Then we've got editing tools, we've got Canva, we've got Videoshop, we've got InShoot and Adobe. These really enhance your images and videos for a really polished look. Use clinic backgrounds, I can't stress that enough. They really give you some real good, powerful before and after images. And track engagement with Instagram Insights and Meta Business Suite. This helps to really refine your content strategy for a better audience connection. Over to you, Shiraz.
Thank you, Michelle. I mean, absolutely stunning cases. You should really be super proud. When I first saw some of these, I was like, really, really life changing. So congratulations to you.
Thank you so much.
Right. So this is the last talk from me for this evening, but it's about turning cases into campaigns, and it's about really focusing on leveraging your results for social media impact. Now, when I write, because I do quite a lot of public speaking and lecturing around the world in dentistry, and when I talk about photography and social media, of course, I think there's an important balance to say that with dentistry and aesthetic medicine, there is an absolute difference in what you're trying to show and what you're trying to achieve. So I'm going to caveat some of the points that I've made in here with points that I would say that are applicable grossly to both medical and dental aesthetics in general. So again, why are we doing it? Why are we deciding to engage? Are we doing it for personal reason? Are you super proud of your work? Is it a professional reason? Do you want to reach out to dentists? Do you want to reach out to patients? Is it industrial? Are you trying to seek partnerships, business opportunities, collaborations? Are you trying to raise the brand awareness of your clinic? Are you doing it just for fun? I think if you're able to understand why you're doing what you're doing, it's going to be able to seem genuine. Michelle has talked about this repeatedly this evening, being genuine. They have to be achievable results that people can reach out to. And actually, I think there's something to be said for when the post or the outcome's overly polished, it almost looks fake, doesn't it? So keeping it,
Yeah.
looking professional, but not looking
Too
so
sad.
edited that it looks fake, So that's really, really important to me. And like we've said, real results reach real people. And it's critical to understand that the people that you're trying to reach out to aren't interested in the technically perfect outcome. When I say this in my lecture, I'm always really talking about myself, because I'm sure Michelle's the same. When we get a case and it's been life-changing, we're still like, oh, if I'd have just got this up a little bit more, if I'd have just lengthened this one a bit more, we really beat ourselves up. And I'm sure I'm talking to everyone that's spending their evening with us around the world today, but we're always criticizing and how we could be just that little extra percentile better. We should keep to that philosophy and mindset for our work. But when it comes to social media, no one cares if it was perfect. No one cares that that brow was up by 1 millimeter compared to the other. No one cares that this cheek was no one cares. And that's the point. Unless you're trying to do all of this for the sake of the profession, in which case you would want to do technically perfect, or learning cases where things didn't quite work out, how you're going to grow from it. So if you're trying to reach, you just have to, again, start with the end in mind. It's a repeated point that I've said through this lecture. If you understand who you're trying to reach out to, that will help furnish the type of data that you need to present to people through photographic and videographic platforms and content. So this was video, and I didn't send it to the team at BTL, ironically, but this is just a scrolling video of my social media, of one of my accounts, where I started posting literally just dental. And what I was doing sort of essentially these rows, where the right row would be a smile, the central row would be either a press release or me lecturing or a quote, and the left row would be for professionals. So what I like doing is, because this is just the way my mind is, it's very simple. I like systematic approach. I just like a systematic look of how my feed appeared to people. That's kind of gone by the by now, because I just post everything on my personal anyway. Probably a discussion for later. But why are we talking about this? Well, because there is lots of guidance, particularly in dentistry, on the use of social networking, and really the professional standards that should be upheld in relation to posting on social media. And I could give you the link and put a reference in for you to go and read the document yourself. You'll enjoy 20 pages over a coffee, I'm sure, but I thought I'd just summarize it for you. The thing is that anything we post, as I mentioned, is made instantly public. Moreover, it's not even your property anymore, let alone your patients. We must maintain boundaries in the relationships between our patients and ultimately our team members. I think that's quite critical. And you should not post anything that may damage the public confidence in the profession. So, in a way, whatever profession you're part of, medicine, dentistry, aesthetics, nursing, reception, if you're affiliated to a medical related business, anything that you do or how you behave in public is essentially an advertisement for the profession. And I think that's why social media professionalism, you may have heard that term before, is so important. So, but they also identify that social media can be an effective way to benefit your work or business. So it's very, very clear that social media is here to stay. And all of those that say, oh, don't do social media, well, that's by the by now. Everyone's there. I mean, you're not even special if you are on it nowadays, because everyone is. So yeah, it's just the summary of this document is that there are things that we ought to be aware of and careful of if we are going to post on social media. And then, of course, the next important point to talk about is it has to be relevant to your platform. So this is my Facebook appearance, how it looks. I've obviously got the banner of an award in the back. It's me holding the award. That's because I'm trying to reach out to certain people in that space. But obviously, when it comes to Instagram, the way that you present your bio, the way that you present the work that you're doing is different. And again, it needs to be relevant to the different platform. Facebook, in my small mind, is a friendship place where people can offer comments, you exchange comments, people give likes, etc. All of that. Instagram is slightly different. It's less personable. It's less based on speaking to people. I mean, you do in direct messages, of course, but you wouldn't necessarily have a conversation on a post, for example. So, where Instagram is really important is in the visual acuity and the brand image that you're presenting. It is essentially a photographic and now videographic platform. So it's about how things look. So everything that you post, where you're posting it, when you're posting it, all of those things need to be accounted for in relevance to the different platforms that you're posting on, if that makes sense. And I've said this already. It's almost like I've got some obsessive compulsive disorder, don't we all? It's all about standardizing your layouts before and after layouts, as Michelle's touched on beautifully. It needs to be the same background. It needs to be the same lighting. It can't be one straight, one at an angle. It can't be one of the whole face and one of the teeth. It doesn't work. Before and after, sometimes it's hard to see when the images are exactly the same. You've got no chance of capturing people if you're showing them in different images. So yeah, and also one thing I'd say that I think's really becoming more and more important is this understanding of color grading in particularly in aesthetic dentistry. Often or an after result will have an element of whitening. Now, if you use a camera that has automatic settings, when it detects something that is whiter, it will underexpose the image because it thinks it needs less light because the focal point is actually brighter. So what that then happens is your before and afters, the after sometimes can even look worse because the teeth look darker and duller. So standardizing not only just your layouts but your lighting settings is really important so that you get this consistency before and after. So I like to give my Dr. Shiraz's social media advice. Quite funny, really. I hate talking to myself in third person, but always get consent for the patient. And if you're doing social media, you have to specify enhanced for social media. I think this is the point that I said I would admit where possible, no identification of the patient face. That's not really applicable for medical aesthetics. So I'd say absolutely ensure that you're getting enhanced consent where the patient knows they're identifiable in any images that you're going to share. Have consistent shots, enhance, optimize the image brightness, and also I'd say the framing. So you can't have a smile that's sort of sideways and straight. Make sure that they are both the same proportions and angulation. And then I'd say just consider using some templates for befores and afters, because that, as Michelle will tell you, is how your brand starts getting recognized. When people see that post come up, they don't even have to look at who it is. They know that layout. They know whose it is. They know that's from Michelle, that's from Shiraz, and so on. So it becomes you're creating that brand awareness subtly, aren't you? Make your feed as attractive as possible for your possible viewers. So don't just have teeth all the time. Say something about when you went out. Like I was at an event with Emma Raducanu, well, actually it was a year ago now, but I posted that on my socials because it was quite fun. She's going to come see me as a patient, all that stuff. But it was just nice to have that out there, and she was really, really lovely as well. I want to post about an award. Oh, I might post about some teeth. I'm lecturing in Kazakhstan in 2 weeks' time. That will go up. I've published this. Just keep it varied so that also people that are trying to reach out to you can see that you're a human being. You're not just a robot. Because in the day of AI and everything, half the accounts, half the people that you're speaking to, are they even real? Whew, Terminator faces on now. But essentially, we have to be seen as being people that people can reach out to. And this is my favorite piece of social media advice. I was on a forum and people going back and forth, and this one chap, Ahmed, I know him really, really well. They were like, "Oh, what would you say if a patient wanted to reach out to you on social media but you didn't know how to respond?" Blah, blah, blah. that his response was, just don't be weird. Don't be weird in messages. You don't need to meet up and go in coffee shops. You don't need a string of emojis. You don't need to necessarily do all of that. Just offer the response in response to their question. And actually, if things are seeming like they're being led in a inappropriate manner, you step back and say, I'm really sorry, this is not what this platform's for. Be okay in saying no. Just don't be weird. That's the best. If you're going to remember anything over this lecture, it's just like, don't be weird. That's all you need to remember, is my social media advice. And I think this is quite a heartfelt point, really. But, you know, I think it is our responsibility to be visible, because we're doing work with dignity, ethics, and integrity. And there are people that are doing work without all of those things and are more visible. So actually, I don't think it's an optional thing to show the work that you do. I think every healthcare professional has a responsibility to show what good, ethical, integrity, good dentistry and medical aesthetics looks like, so that people can find the right solution, rather than being shoehorned into a clinic that's going to see 100 patients in 10 minutes and so on and so forth. Not that I'm saying there's anything wrong with that. If that's your business model, great. But we have a responsibility, because everyone else is trying to get out there, and we can be that voice to help people get the right level of professional care. Thank you.
Thanks, Shiraz. That's fabulous. So, from scroll to consult, creating content that attracts the right patient. So I think Shiraz has touched on this, building trust online, generating consultation inquiries. Building trust means being visible as a practitioner, and that doesn't mean that you have to be confident in front of the camera and the centre of every post. Your presence and should align with your comfort level. Whether it's voiceovers, behind the scenes, educational content, there's plenty of ways that you can build trust without feeling overwhelmed. Introduce yourself and your team regularly. Talk about your qualifications, your clinic approach, your ethos, your values. Let the real you shine through. People trust when people feel like they actually know you, and they really get to like you that way. They know who the clinician is that they're talking to before they even come into clinic. So, actually, what do patients really request? Do we understand their goals, and can we actually speak their language? Capturing content that attracts the right patient obviously leads to consultation, and this starts with capturing their attention. How do we do this? We need to speak their language. We need to understand their concerns, their goals. People are far more likely to engage with you when they feel like you are directly talking to them. At my clinic, I regularly run questionnaires to gather patient feedback. This really helps me to tailor the content to reflect how my audience actually thinks and feels, and not just how I assume that they hear me. It's about creating new, meaningful, relatable content that communicates and builds trust and encourages actions. Let me just go back to that as well, guys. I just wanted to also say, what I normally do when I introduce a new treatment, a modality, a product into clinic, I'm always really eager to gauge my patient's familiarity with it. So in order to gain some meaningful insights into their knowledge, their goals, their motivations and expectations around a new treatment or therapy, I always conduct an anonymous survey and make sure that I target a diverse group of patients of all ages, both men and women, who are already receiving treatment at my practice. So why is this important to figure out your patient's understanding of the treatment, a product or modality? For me, I think this is really, really vital. It helps me hone in on keywords and terminology that the patient will use. And it helps me really speak their language when they come in for consultation, which is really important when it comes to promotion, marketing, and ensuring that your consultation converts into a booking. So what do patients request when speaking their language, and what do we understand as their goals? Natural, undetectable, better skin, lifted, good skin. Here are some of the key highlighted positive words that my patients attach to skin goals when they complete the surveys. How many of us hear these phrases on a daily basis during our consultation? When you do these anonymous surveys, when you're introducing a new product or modality or treatment in your clinic, this information is so invaluable. You can really unpick it. It helps us inform the patient during the consultation process. We can speak their language, we can engage, we can really grab their attention. And ultimately, it informs us how to improve patient education. We can use the highlighted key phrases to really convert our patients to a treatment if it's deemed suitable. So, before and after images we know are your biggest marketing tool at consultation. And I really find that patients don't want to see corporate or generic marketing materials like flyers and brochures. I think this is the kind of thing that they want to take home and read in their own time. On the day of consultation, they really want to see images that you as a clinician are able to deliver. If you're starting your BTL journey, you can also always showcase results from BTL's stock library until you hold and build your own portfolio of results. I personally always have a small library of results from patients who consent to share images. I utilise these during my consultations. If a patient comes in with concerns of ageing, asymmetry, body concerns, I will choose a relatable result I've achieved and showcase it. It's that easy. This helps to build further trust and confidence in your ability as an injector. And remember, patient feedback is also one of the most valuable marketing tools we have. Really encourage your patients to leave reviews on platforms like Google, Trustpilot, Google. This really builds credibility and attracts new patients. It really, really does. But what happens if you don't have those access to testimonials or visuals? It's simple. Ask the patient to leave a review. It really is that simple, and you can use these in your future marketing campaigns. Another effective strategy that I find is host a model day where selected patients will receive the treatment in exchange for permission to use their photographs on your social media and in your marketing. This allows you to build a really strong portfolio of high quality content. But also, when you do this, ensure all your models sign release forms and consent to use photography prior to the treatment. In January 2023, I proudly introduced BTL's Enphase device into my clinic. It was my first purchase from BTL, and it certainly hasn't been my last. I now have 4 of the devices, and wow, what an investment Enphase has been. Enphase is really redefining facial rejuvenation by addressing 2 causes of aging: loss of muscle tone and collagen depletion, without the need for needles or downtime. How fabulous is that? Beyond aesthetics, it represents a paradigm shift in improving facial balance and symmetry, offering therapeutic benefits for patients such as facial palsy through muscle stimulation, enhanced circulation, and tissue regeneration. Here are just a few of my patient results that I'm now going to showcase utilising Enphase as a standalone modality or a combination approach, whether that be toxin or injectables. And all of these clinic photography incorporate the key elements that I discussed for photography in my earlier post, and this is what makes a really good social media post. This is Kel, 42-year-old patient, who presented with concerns of signs of ageing, volume loss as we could see in her face, heavy hooded lids and prominent nasal labial folds. After consultation, we decided a course of 4 Enphase treatments was recommended. She wanted something with no downtime, she could go back to work. And after the first session, we could immediately see a visible reduction in the nasal labial folds and increased volume was apparent. As we went through the treatment plan, you can see here, this is after a course of 4 sessions. And we've got a significant reduction in the nasal labial folds, a significant brow lift was apparent, and we now see a nice amount of eyelid now visible. The static lines across the forehead had diminished, but the overall skin quality was absolutely beautiful. Objective photography, the standards were met, it was a powerful before and after, and this really generated a lot of interest and bums on seats in my clinical practice for Enphase. Meet Gabby. Gabby's a younger patient. She presented with concerns about ageing around the mid-face and mouth area after significant stress in her life. She wanted something with no downtime. We opted for Enphase, 4 sessions. And you can see we really achieved a significant lift in the cheek and the nasal labial fold, eyebrow position was beautifully lifted, the skin looked bright and more even. We met the photography standards. It's an excellent visual to sell in clinic and really promotes and showcases the power of M-Face. So a large part of my work involves treating patients with asymmetry or facial palsy. I'm very passionate about this. And I'm the founder of the Facial Palsy Association. This is a professional association that supports those affected by facial palsy, raising industry awareness of the associated conditions, the causes and the treatment pathways, and support available across all sectors. Now, this patient result demonstrates the efficacy of M-Face as a standalone treatment for asymmetry. And this result was after a single, and it is only after a single session of M-Face. The treatment aimed to improve her facial symmetry with a focus on tightening and strengthening the elevator muscles of the face. I'm able to adjust M-Face settings individually to stimulate the appropriate muscles. In addition to muscle activation, the radiofrequency compartment generates tissue warming, which supports local blood flow and circulation. Objective met for photography, high quality, impactful, powerful content, really building my clinic's credibility and making my social media work. Meet Catherine. Now this is a superb result, and this was a really challenging case. And this actually won myself Best Non-Surgical Result at the Aesthetic Awards 2025, which I'm incredibly proud of. This utilised a combination of a course of M-Face and toxin. This was a 55-year-old lady who presented with facial palsy and a severe ocular syncosis. This means she has an involuntary eye closure during voluntary mouth movement. Self-esteem, confidence significantly impacted. 4 weeks post-M-Face and an individual toxin treatment plan as a combination approach. And what do we see? A significant improvement of her oral ocular synkinesis, no involuntary eye closure during voluntary mouth movement. Wow. This further restored her facial balance and symmetry, a tangible evidence of an improved smile, a reduced pronounced nasolabial fold on the unaffected side, and a narrow eye aperture vastly improved. The patient actually reported increased facial muscle mobility and reduced facial tension. Her overall skin texture and quality was significantly improved. And the patient described this as life-changing and a dramatic boost in her confidence. And I think we can all agree this is a really powerful, high-quality, engaging, compliant before and after. Powerful content, incorporating the key elements that I discussed in my earlier slides, which makes an amazing before and after and a very good social media post. Some more of my before and afters utilising M-Face for facial palsy management. As you can see, these results in my clinic photography display the elements we discussed earlier. What makes a strong social media post? Consistent facial expressions, strong results-driven approach, showcasing clear befores and afters, immediately grabbing attention. Consistent same angles, eyes in the same direction, really good lighting, that isn't too harsh, and that showcases real results. It's a branded background, it's compliant content, it's relatable. There's no hard sell in the treatment. There's no editing. This is just incredible, honest results that build credibility and takes digital marketing to the next level. This result is a gain from one of my facial palsy ladies who had M-Face a course of 4 as a standalone treatment. For those that are interested, I'm actually launching my facial palsy management e-learning platform next month, and I'm super excited. My platform will be for medical professionals only. It will have clinical training, step-by-step comprehensive consultations, advanced treatment protocols for botulinum toxin, specific to facial palsy presentations. Obviously, it will incorporate M-Face technology. It's amazing. Understanding electromagnetic muscle stimulation principles and their application in facial asymmetry. It will include case-based learning, real patient scenarios with befores and afters documented. Anatomical precision, safety protocols which are evidence-based for minimising complications and optimising results. And it will all be CPD accredited. which will contribute to your professional development. In addition to this, I'll be providing some one-to-one training and group training. So please save my details on the next slide if you're interested and reach out. Thank you so much for taking time out this evening to join myself and Dr. Shiraz. Over to you, Shiraz.
Thank you all. Michelle, what you're doing is quite frankly incredible. I mean, particularly the facial palsy work is, I mean, it's staggering, the results. And you know, I definitely feel super proud when I've been able to give the patients an emotion and a smile back, but being able to give the whole face back, I mean, essentially, that's just, it's hugely inspirational for me. So thank you for sharing those amazing cases. I think I might find myself on your course, actually. So there you go, first booking, guys. You guys on there, get booked on as well. So we could probably get James back as well, actually, if
Yes.
we want to. But essentially, what we're here doing is just trying to raise awareness and understanding for all things photography, social media, professionalism. We're in the world of aesthetics, so things. It's about the way things look, or the study or enjoyment of beauty and nature. And what a better way to showcase that than with photographs. So yeah, the use of social media. James, I'll let you talk about the bits of the workshops we're going to do and things like that.
Thank you. I was going to say, just firstly, thank you to Michelle and Shiraz for that presentation. Some truly fantastic insights and practical tips on that, which leads us on. So we're actually going to look to run an in-person content with Shiraz and Michelle down in London, and one in the north, hopefully in Liverpool, somewhere near Michelle in the north. So Ellie's going to share a link in the chat now, and if anyone's interested in that, we are taking pre-registrations. We'll be sending further details out, what this course looks like, and dates later in the year, if you'd like to get signed up for that. And equally, obviously, Michelle's touched upon there one of our devices. If you want to find out anything more about any of our other BTL devices, please reach out in the chat, or alternatively via our website. We will always bring the devices out to you guys for one-to-one demonstrations in clinic and things like that. So it would obviously be great for us to explore that further. And finally, like I say, just a massive thank you to Shiraz and Michelle for this evening. Their details are going to be on the screen if you'd like to reach out to them directly regarding any questions for this evening, or alternatively anything further from the webinar. So yes, thank you all for attending. I really do appreciate that. And thank you, Michelle and Shiraz, as well.
Thank you, James. Thank you so much.
Thank you.
I thought that was fabulous. Very insightful.
Thanks, everyone. Have a great evening, and get in touch with us. We look forward to seeing you guys really, really soon.
Thanks so much.